On Sunday, November 27, 2022, at the Osogbo City Stadium that was filled beyond the capacity, Osun State Governor Senator Ademola Adeleke took oaths of office and rolled out the roadmap that his administration will follow to justify the confidence of the millions of the state residents that participated in the election that produced him as the governor on July 16, 2022. In his inaugural speech, Senator Adeleke said the health sector in Osun State was in need of urgent attention, promising that his government will give premium attention to the improvement of the primary health care services. He pledged that his administration will improve the working conditions of health workers and expand the coverage of health insurance scheme. He added that the state government will establish a standard diagnostic center using the public-private partnership model and adopt measures that will retain medical practitioners in Osun State. To fact-check these claims after 1 year in charge of affairs of the state, findings by Dateline shows that the governor has left no stone unturned in keeping his promises. The first move to signal his commitment through this pledge was the unscheduled visit to a primary health center located in a remote area in Otaifun, Osogbo, where the governor expressed shock at the poor state of the facilities found at the center. The beddings were poor, medical records were grossly inadequate, and the workers there lamented poor working conditions, which according to them has been driving their colleagues out of the state in search of greener pastures. To action his words, the state government organized a free medical/surgical outreaches tagged Imole Medical and Surgical Outreach, where people had their medical needs attended to in all 3 senatorial districts and 9 federal constituency headquarters across Osun State.
All the health workers in the states come together to take care of the people who are in need. We realize that quite a number of people who are in one need or the other, and they couldn't afford it. And it was his intention to reach out to these people, and that was why he set up this committee to say that we go around and we take care of the patient, the citizen of the state. And so we had that in February, and then today again we're having the second phase of this, and we are rounding up. We've been to 5 sites, 5 locations of Ilesha, Ila, Ede, Ife. And now today we are here. And so the purpose is again to take care of the people who are in need, who could not afford the cost of care. And we have quite a number of these. We have people who have surgical need, hydrosis, hernia, lipoma, and other swellings in the body. We also have the second group of people who are who have medical needs, hypertension, diabetic, malaria, typhoid, and tuberculosis. All this, and we make routine screening and diagnosis so that people know. Somebody who never knew that he was hypertensive.
Dr. Akindele Adekunle is the special advisor to Governor on Primary Health. He said the state government has done very well in identifying the routes within the health sector. According to him, the governor has clearly demonstrated his roadmap to revamp the health sector during the launch of the multi-billion naira infrastructural development plan.
You agree with me that this is very unprecedented in the history of the state. When we came on board, one of the 5-point agenda of His Excellency is provision of a healthcare delivery system. And what we met on board was very appalling. You agree with me that the primary health care center is the nearest medical facilities to our people. Despite the fact that the outgone government claimed to have spent huge amount of money to revitalize, renovate those health centers, when we went around on inspection, we discovered that it was contrary to what they told us. In those centers, there are no water, the boreholes there are not working, there are no drugs in there. The beds are not good, there are no personnel, even the infrastructure, that's the building too, were all bad. And we said, well, the closest you can have to our people in terms of healthcare system, primary healthcare, so let us focus on the primary healthcare system first. And the governor has graciously included the total renovation of those healthcare centers, 345, in his 100 billion infrastructure development program. And it will go a long way to improve the health of our people.
Also corroborating this, the Executive Secretary of Osun Health Insurance Agency, Dr. Razak Akindele, said the governor has kept his promises with the people as far as health sector is concerned. Dr. Akindele said the governor has improved working conditions of health workers in the state with the approval and continuous payment of hazard allowance for all health workers across board.
Part of the events to commemorate this first year anniversary, His Excellency will also commission the new complex, the new office complex of the Osun Health Insurance Agency, which is located in Abere. It's a befitting complex that the governor has worked tirelessly on to achieve, and that will roll out in the next few days. You will get the information about that. He has also been committed to the health of all individuals in this state, not only even the citizens, even the health givers. You will recall that he approved the hazard allowance, full hazard allowance, as implemented by the federal government for all categories of workers in Osun State. That's really something to be happy about, and that has to a large extent reduced the Japa syndrome in Osun State. Before now, almost every day you will see health professionals leaving the state for other states and for greener pasture outside the country. Since the announcement of payment of full hazard allowance, this has significantly reduced.
It will be recalled that Senator Adeleke promised to expand the Osun Health Insurance Scheme. It was in the light of this that the governor flagged off the enrollment of pensioners for the scheme, which has seen thousands of senior citizens captured in the program. Some of the retirees already captured were full of gratitude to Senator Adeleke for prioritizing their well-being at old age.
To do with the very kind gesture of the Excellency Ademola Adeleke is extending the palliative to us, giving us a health insurance scheme free of charge, without any charges. We will be registered and continue to enjoy free treatment. I think to some level, but if it needs referral, I think they will also do it. And so we are very grateful to the Excellency for counting us worthy to enjoy such an opportunity.
World, there is a scheme for insurance in all forms, especially for health sector. And where we are retirees, especially, we don't have money to take care of our health care. And our government has sort of deemed it fit to assist us, we country retirees, to feature into this health insurance scheme. We give kudos to him, we thank him a lot. It's very, very laudable.
A lot of us are just dying undergroundly because they cannot afford very little things to buy this medication. So I want to really say that this government is really doing well. It's really making us happy for this kind of program, because health is wealth, you should know that. And if you are able to take care of our health, at least things will be better.
The Executive Secretary of Osun Health Insurance Agency said the state government has been able to fulfill its pledge to expand the Osun Health Insurance Scheme.
Our governor recognizes that, and he says, your old age should be peaceful. Wọ́n lẹ́yìn tó bá fẹ́ bímọ, ó yọ̀ fọlọ́mọ. Gbogbo wa náà la ń gbàdúrà pé ká fẹ̀yìntì láyọ̀, káwa náà jẹ́ òṣìṣẹ́ fẹ̀yìntì. Tá a bá wá tọ́jú àwọn òṣìṣẹ́ fẹ̀yìntì sí tó bá kọ̀ gbà tiwa náà, kí ni ó ṣẹlẹ̀? Ẹ jẹ́ ká pàtẹ́wọ́ fún ìmọ̀ọ́tọ̀ bẹ́ẹ̀.
For Deadline, it has been Abdulrahim Adekilekun reporting.